This is Dr. Jerry Hesch, physical therapist, and I work at Hesch Institute in Aurora, Colorado. And we've been treating Lynn and her husband, and we've done some interesting posting on their presentation. And I asked Lynn to remind me to check her distal foot on the left because she fractured both metatarsals 1 and 2, and those are these long bones in the foot. This happens to be a right foot. And so in checking them out, they seem to have good mobility. However, the phalanx, the proximal phalanx, which is this almost 1.5 inch long bone, bottom of the toe bone, there's another one at the very end. On her left metacarpophalangeal joint, it only flexed 20 degrees, and on the right, it flexed 40 degrees. And the same thing was found on the second metatarsophalangeal joint on the left. So it's unusual for me to treat this part of the foot. And so I thought this was worthwhile to post as an interesting presentation. And distracted the joint, twisted it a bit, and then flexed it, and did some gliding of the phalanx, and it restored the ability of this MP joint to flex on the left side equal to the right side. So then she walked up and down the hall a bit, and she has always noticed that she tends to supinate, tends to roll out, which makes sense because she's not able to toe off of that because it has reduced mobility in both directions. And I failed to measure extension, which I certainly should have done, and I would submit that her extension range of motion also changed in response to that maneuver. So the next time I evaluate someone for such, I'm going to test extension as well. So she actually noted that she had easier rolling onto the toe with a reduced tendency to roll on the outside of her foot, avoiding full extension on those 2 toes. Can you elaborate on what it felt like when you walked?
Felt like I was rolling, my foot actually rolled in more. Instead of walking more on the outside of the foot, I was rolling in and toeing off.
Very good. So yeah, so it's just unusual for me to work on that part of the foot, and it cues me to pay more attention in the future with my clients and pay attention to what those 2 joints are doing. And I will, of course, measure not only flexion but also measure extension of the MP joints. And thanks for letting us share that. I appreciate it. Thanks.